What should you do if you're just stuck in your dental sleep medicine practice and you're just about ready to give up on dental sleep medicine, not just as an adjunct service, but just give up on it altogether? Andy Stanley, he's a pastor. One of the things he says that I really like, he says, nothing is going to change unless something changes. And change always brings two results, one of two results. You're going to experience a positive change as a result of whatever change you implement, or a negative change as a result of whatever change you implement. The important thing is that you make a change. If you've just been stagnant with dental sleep medicine for the last year, 3 years, 5 years, nothing is going to improve unless you make a change. You're not going to know if something can improve the situation in your dental sleep medicine practice unless you actually make a change or make a shift. So really, really important. Start looking at areas where you can make changes. I know it sounds really simple, but it's one of the most effective things you can do if your dental sleep medicine practice is stagnant, is to look at opportunities to make changes.